there are three types of options, I would say. One is the use of drugs that relieve symptoms, but we don't have any evidence to improve prognosis. Really, the only example of that is diuretics. Then there are drugs that we would describe as disease-modifying drugs that improve life expectancy or reduce the risk of hospitalization. And there are a few of those, ACE inhibitors or ARBs, more recently sacubitril-valsartan as a better alternative, beta blockers, mineralocorticoid receptor antagonists, and a drug that doesn't reduce mortality but does reduce the risk of hospital admission, and of course that's ivabradine. And another drug like that, but much older, is digoxin. And then lastly, there are devices. There are a number of different types of devices. Implantable cardioverter defibrillators reduce mortality, and cardiac resynchronization therapy that reduces both mortality and the risk of hospital admission. Well, it depends whether you believe a patient with heart failure is ever stable. I don't believe that they are. There are some patients who've got mild symptoms, other patients have got more severe symptoms. Sometimes people are admitted to hospital, sometimes they're ambulatory in the community. And as far as we can tell, the benefits of sacubitril-valsartan are consistent irrespective of symptom severity, quality of life, risk as defined by, for example, risk score. And we even have evidence, which we published recently, showing that in the Paradigm heart failure trial, patients who were admitted to hospital with worsening heart failure during the trial were less likely to be readmitted during follow-up if they'd been randomized to sacubitril-valsartan than randomized to enalapril. And another proxy for stability is whether or not a patient was in hospital recently before randomization into the Paradigm heart failure trial. And again, we've recently shown that whether a patient was recently discharged from the hospital before randomization, whether they'd been in hospital a long time ago before randomization, or whether they'd never been in hospital in the past, they still got a consistent benefit from sacubitril-valsartan compared with enalapril.